every one of us has strengths, and when we're struggling, we need to look for those strengths ourselves. Sometimes you can show this to individuals, but many times we just do this together as a staff, because a lot of times when my resources are low, I can get so triggered by that. So we tend not to show this to patients, but among our staff, when we're having somebody who's hitting the wall with their health and we just can't seem to get them through to be treatment compliant, we can bring this out and say, what are this person's strengths? Who are their bridging and bonding social capital? Who can we draw in? You may not have those kind of conversations, but you might have them in an environment such as grand rounds, where something like this might be very positive in helping that patient to achieve their treatment outcomes. Okay, so if you look at bonding and bridging social capital, here's a model for that. For those of you that maybe work in a clinical environment where you see the patient repeatedly, and you have a relationship with that patient, that you can say when you're doing the treatment plan, put yourself in the middle and draw a circle. And I am going to have to get this. Okay. Put yourself in the middle. Now put everybody that you hang with, that your friend or relatives that are in your life around you, okay? And then look at your treatment plan that we've designed and what you need to do. Who's going to really be behind you on that? Well, my friend, because I'm a new diabetic, and she's been a diabetic and she handles it pretty well, so I think she's going to be a big support to me. The others, I don't know so much. I mean, maybe my husband will be somewhat supportive, but I think he's just going to want me to keep cooking the way I always have, and I'm kind of like, if I'm cooking it, I'm eating it. So I'm going to have to change how I'm thinking about food here. Otherwise, I'm just going to be in a diabetic coma because I'm getting to be a brittle diabetic. So you start talking about all this thing, and maybe that person is not generating all those answers that I just expounded, but you're leading that person towards that. And who's going to be supportive, right? And for some reason, maybe the mother is not supportive, and there are some others who aren't. If she needs to quit smoking, maybe she smokes all the time with her brother out in the back porch, and so he's not going to be too happy for her to quit smoking because that's their together time. So there's all sorts of reasons, but it helps the patients to see who's behind me on this one thing. Not that they don't love me, but who's going to be my support system. It also helps the healthcare provider or the public health system to see who the support of bonding social capital is.